Hi, I'm Matt Elvin, and welcome to Fearless Friday. About this time in 2016, there was an ABC News report on some research performed at Memorial Sloan Kettering and Cornell University on the percentage of terminally ill patients who really understood or fully understood their diagnosis. And what's interesting about this study is patients were asked what stage cancer they had, their current health status, how long they expected to live, and if they had recently had a life expectancy discussion with their doctor. Surprisingly, only 5% of the patients accurately answered all four questions and really understood the diagnosis of their disease and their prognosis correctly. Now, that's just crazy that in today's day and age, it's only 5% really understand what they're facing. And when you receive a cancer diagnosis, being properly diagnosed is crucial to your outcome. It's also very important that you understand what your diagnosis means to you as a person, not as an average of a small group of people that a lot of today's care is based on. It's important that you understand specifically what's going on in you, not what's going on in other people like you, but what's going on in you and what you can do to ensure you've received the best diagnosis today's medicine has to offer. Which brings me to today's guest. Today we are honored to have Dr. Julia Elvin with us, and Dr. Elvin is Vice President and Senior Associate Medical Director at Foundation Medicine. She joined Foundation Medicine in January of 2014 and came to them with 8 years of experience as a senior pathologist in diagnostic pathology, and just has an incredible set of credentials. Dr. Elvin has a particular interest in both the molecular drivers of cancer, and she has a strong background in ovarian cancer. And I understand, first of all, Dr. Elvin, thank you for being with us today.
Thank you so much for the opportunity to speak with you and to get some of this very important information out to your broader community in the US and worldwide. I really appreciate it. I think this is a great mission. It's very well aligned with what we're doing here at Foundation Medicine and with my personal passion of helping cancer patients with both GYN malignancies, but also any cancers from any part of the body.
If you're a newly diagnosed cancer patient, you just received a diagnosis, what should your first step be?
A diagnosis of cancer for anybody in their family and their community is one that can be really overwhelming. And it's important to keep in mind a couple of critical initial steps that will ensure that the treatment plan, even the initial treatment plan, is appropriate. The very first thing I always say to my family, to my friends, and now to everybody watching this is that the most important second opinion that you can get is probably not from a surgeon, not from an oncologist, but from a pathologist. The doctor that you never see, the one that you don't even know that you have. It is the person who trained specially in looking through the microscope at a small sliver of the tissue that was taken out at the biopsy or the surgery. Whatever name that doctor puts on the report is the key that determines the options that are presented for the next step and really the whole course of the treatment plan. So making sure that that first diagnosis is confirmed by a second pathologist is really something that I think a lot of people don't know that they can ask for, or that they should consider doing. And this is a test, this is something that can be arranged through the pathology department or through your oncologist. Usually they have the ability to have your slides sent from the original hospital to a nearby institution that may have more experience in that particular type of diagnosis. And this can be arranged pretty seamlessly, and you can get that result back in a fairly short period of time, usually 1 to 2 weeks to get confirmation of the diagnosis, if not sooner.
You talked about very few patients really understand that they can ask for that, and you're right.
I think we're in a really interesting phase where we have a really exciting tool that we are trying to integrate with the old way of doing things. I do believe that in the not too distant future, the name that gets assigned to a patient's tumor, so the diagnosis, will have almost a requirement to have some of these molecular markers defined. We're definitely moving from a day and age where the label for somebody's tumor is a combination of where we think it started, like the ovary, and the pattern that somebody like me sees under the microscope, let's call it serous or non-serous cancer, to a time when maybe we consider the mutations, the changes in the patient's tumor cells themselves as being the defining characteristic. So we may group patients into ovarian BRCA1 mutated tumors and BRCA1 not mutated tumors. That might end up, and I think it is becoming, a more critical distinction as we go forward, where people are selecting the drugs and the additional therapies based on these different kinds of gene mutations that we can find. So right now, the state of the science and the recommendations says, let's move forward a little bit more cautiously. Let's be optimistic that people will, that the proportion of patients that are cured by the surgery will never need to know the molecular features of their tumor, and we'll reserve this tool for the patients that we know are going to need more therapy. And maybe in the future, we'll see this even moving earlier into the diagnostic phase.
It's really interesting. And I'm certainly not a medical expert, but I've lived with stage 4 cancer for 8.5 years. So I feel qualified to say some things, at least give my viewpoint and perception. And what I'm reading about the innovation and the new ways to treat cancer, personally, I want to know what my mutation is, even if it is an early stage, and even if it is can be curative by surgery, because if it happens to be one of those mutations that is somewhat aggressive and lies along a more aggressive pathway, and we're showing some promises in immunotherapies in ways that we can tweak our immune system so we can stop that. If it does start to come back, our immune system will stop that from happening. Don't you think that's really valuable for a patient to know?
So first of all, I have to say that when you say that you're not a medical expert, having been a patient and lived with your diagnosis for 8 years, I think that qualifies you actually as an expert in this. And I think that your comments are very, very valid. you probably know more about lung cancer than many people in the medical community, especially, when it comes to cutting edge technologies. So it's true. There's a lot of value that comes from the information that we can get from molecular profiling of tumors. In my opinion, the information is never a waste. If it helps you be more strategic and less reactive to the disease, that's power. One of the considerations about employing any tool is to think about the cost and the benefit ratio. And some people view the benefit that comes in identifying new therapies right when you need to go on them as being the highest value. But you make a really great point about learning some of the molecular drivers of the cancer early on, and maybe finding opportunities earlier in the sequence of treatments where they can be impactful, more impactful, or maybe give the patient and their family more time to plan. To this point, a study that was just presented at the Society for Gynecologic Oncology meeting in New Orleans at the end of March by the GYN Oncology group out of UCSD, who has been doing tumor profiling on their ovarian cancer patients and some of their other GYN malignancies. They looked at their experience about taking the information that they were getting from doing the testing, and they found they had concluded about 70% of patients had some result on this test that suggested maybe a clinical trial or possibly a different therapy. But they found a very small percentage of patients actually were able to either take advantage of the clinical trials or get access to those drugs or stay on the drugs. And when they dug into their data a little bit more, it would have been very easy for them at that point to do what some people have done, which is throw up their hands and say, well, maybe this whole process isn't worth it, or isn't it, maybe it's not ready for prime time, maybe we should wait and try again later when there are more drugs and more trials. But instead, they really thoughtfully dug into their data. And what they found and what they concluded was that they were waiting until the patients were very far along in their treatment, where they had maybe third or fourth or even later lines of therapy, and where the patients had either had too many lines of therapy, which disqualified them for some of the trials, or had built up a lot of side effects and toxicity, and they weren't able to tolerate the side effects of the drug that the molecular markers were pointing to. And their conclusion was, maybe if we did this testing a little bit earlier in the disease, it would give us time to plan for the best point at which to act on the genetic information and not do it as a last-ditch effort when sort of all else has failed. And I thought that was a very thoughtful and thought-provoking study, and I think really speaks to your point about where in the continuum does this best fit in. Certainly, it fits in better, not after, not as sort of the last thing you think about. Is it the first thing to think about? I think we're going to have some differing opinions if you go to a variety of experts, but certainly putting it earlier in the decision pathway gives us more time and gives us honestly more value from the results that you get. Gives you more time to use that information strategically.
Well, thank you so much. We know how busy you are, and thank you so much for taking the time to talk to us today. It's just been a wealth of information that that so many patients out there need to hear, and survivors as well. So thank you for coming today.
Absolutely. Thank you very much for having me.
Survive It is an organization of survivors helping patients, survivors helping survivors, and caregivers helping caregivers, everybody helping each other. And if you have been affected by cancer in any way and have questions about any topic for any reason, please feel free to reach out to us at info@surviveit.org, because we are here to help. Until next time, I'm Matt Elvin. Stay strong and live fearless.